A County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and I'm delighted to welcome two guests to the program today. Both guests are from our public health unit in Grey Bruce. Jason Weppler, who is manager of oral health and chronic disease and injury prevention, and Nicole Foster, who is a dental health educator. And they're both here to talk about dental programs, what's been happening even through COVID, and some exciting news about a construction event that's occurring. So thank you both for being on the program. Now, do I have your titles right? Because they keep changing. People keep changing their portfolios. Did I get it right?
You got mine right. It's a mouthful. So yes, program manager of both the oral health and chronic disease and injury programs here.
But I also know you as being an organizer of the vaccination hubs and actively involved in that too. So, but thank you. It's so delightful to talk about something that's healthy and moving us forward from COVID-19. So thank you to both of you. Who'd like to begin and tell us about the program as it is? And then, of course, we can even begin with the exciting news about the construction. So you get to choose.
Well, I can take us from the top here. So yeah, it's really nice to be speaking about a topic outside of the pandemic, and hopefully that's drawing to a close. But throughout this whole pandemic, Carol, we've been operating our dental health services at the Grey Bruce Health Unit. We've been trying to offer our programs as much as possible, knowing that staff have been supporting other pandemic endeavors as well. But we are back in our schools currently, so we do a school screening program with a variety of age groups in our local schools. So this includes all our public, our Catholic, our private schools as well. So we do go in and screen kids and looking for areas of decay and issues in the child's mouth, and then referring them to other programs. But in our clinics, we've also been running our Healthy Smiles Ontario program, which is a program for children 0 to 18, and then our Ontario Senior Dental Care program as well, which is for seniors who qualify that are over 65 years of age. So those programs have been ongoing throughout the 2 years of the pandemic.
So you also provide programs. I did a little bit of looking up just to make sure I was familiar with this, because it's been a while since we've talked teeth. So you also provide preventative oral health services for Inuit and First Nations children up to 7 years of age, correct?
Yeah, that's a partnership we have with Indigenous Services Canada. So that's a federal funded program. And we do work with our two First Nations communities in Grey Bruce and surrounding areas, including Indigenous Living Off Reserve, to provide that program for those, as you mentioned, 0 to 7 years of age.
So even throughout the pandemic, you have been providing this service.
This particular service, which we call our COHI program, which is our Children's Oral Health Initiative program, has actually been on hold.
Okay.
That was a joint decision between the Public Health Unit and our Indigenous partners to just put that program on hold. But we did make some steps towards relaunching that program in the fall, and we do have plans to get that up and running again, probably within the next few weeks.
Now, where does the funding for the programs come from, Jason?
The majority of our funding comes from the Ministry of Health. So they do fund specifically our Healthy Smiles Ontario program, as well as our Ontario Seniors Dental Care program. And as I mentioned earlier, the COHI program does receive federal funding.
You have partnerships with local dentists. I'm not sure if Nicole can speak more to this, or it certainly would be helpful, Nicole, to know what your role is as far as a dental health educator.
Yeah, so I'm a dental health educator, otherwise known as a dental assistant. We offer the preventative service only for children, and we see them at our clinic. And then children can also get enrolled into the Healthy Smiles program, which they can be seen at any dental private practice that offers to see Healthy Smiles Ontario clients. And then with the Seniors Dental Care Program, it is only at our health unit that they can come and see us. We have 3 dentists that work for us there. And then we do have a couple of other, a denturist that's on board with us that we contract out to. And if there's any major work that requires an oral surgeon or an endodontist or a periodontist, we can refer to a contract dentist as well that we refer to.
So there's quite a variety of services that are offered for sure. For anyone who's listening, who's wondering, okay, I'm a senior, how would I know if I qualify? Or, I'm a parent, I think my child needs to be assessed. How do I do this? You mentioned about the schools, but do you also do outreach and provide services to Amish and men and those communities as well?
You threw a few questions in there, Carol. I'll start with the.
I'm on a roll.
I'll start with the requirements to be eligible for the Ontario Senior Dental Care Program, if there are any seniors listening in. So for that program, you need to be over 65 years of age. You need to be a resident of Ontario, and you need to meet a certain income threshold. So for an individual senior, that's an income of $22,200 or less, or for a couple, $37,100 or less. And then you also can't be receiving any kind of other dental benefits through government or personal. So you would need to meet those 4 criteria. If you do, and you're interested in our program, you can certainly call into the health unit and speak or ask for our oral health info line, and one of our staff can certainly give you some direction about how to go about signing up and getting that senior's dental card so we can treat you here at our clinic.
Okay, and that's really important. And Nicole, you were mentioning about there's contract services for a variety of dental care. And also the Healthy Smiles program links with dentists, but not all dentists will offer that program, correct?
Yeah, that's correct. It's their choice whether they accept Healthy Smiles Ontario. There are a lot of dentists in Grey Bruce that do accept the Healthy Smiles Ontario. But again, as for seniors, they do have to come and see us, and then we make the decision if we need to refer out. But we do most of our work in our clinic, which is great.
So the clinic itself is located in Owen Sound?
Yeah, it's right at the health unit, right inside the health unit on the first floor.
Yeah, and it serves all of Grey Bruce. So anyone in Grey Bruce can have the service provided, and they would come. So tell me a little bit about the clinic itself, what exactly you provide. And I understand there's going to be a change, a renovation.
Do you want to speak to that, Nicole? I can speak generally to the renovation. So back in the fall of 2019, the health unit did apply to the Ministry of Health for some capital funding to do some clinic upgrades to both our clinics in Owen Sound here at the health unit building and in Markdale. So we have a small office clinic in the Southeast Grey Community Health Center. So we did receive funding to do some upgrades for both those clinics, knowing that we would be serving our seniors clients. This is a new program, the Seniors Dental Program, just started in January of 2020. So the ministry acknowledged that if we're going to be treating lots of seniors, we needed to upgrade our clinics accordingly. So we did receive funding. Our Markdale renovations are complete, so we're excited about that. It looks great. We have a full operatory there with a full array of services. And then our Owen Sound construction is ongoing right now. They started January 7th, and we expect to be done around March 21st. So we're about the halfway point, and we're seeing some great progress downstairs, which is wonderful.
So the program can be offered in Markdale as well, then?
Yeah,
for
so
seniors?
we do have 4 actual clinics in Grey Bruce. So we have our Owen Sound Clinic here at the health unit, the Markdale Clinic I referenced, and then 2 in Bruce County as well, 1 in Walkerton and 1 in Wyerton. For our seniors clients, we do see them here in Owen Sound because this is the one location where we do have the dentist services. We just have the capabilities to treat those clients here. So in our other sites, we're typically seeing our Healthy Smiles Ontario children at those other clinic locations.
So with the renovations and the grant, which is great to get the funding for it, how will it be different? Will it just be being able to serve more, or I assume you have the space, but how will it be different than what you're offering because of the renovations and the construction?
So we're adding a third operatory in, so there will be 3 full clinics in there, operatories. So yeah, it will benefit us to see more clients, to be able to see and double book clients into 2 different operatories, while the hygienists see more clients as well.
Okay. So the services you've been providing will continue, and the services haven't changed. It's the volume of the numbers that will be the greatest change. Am I right in saying that?
That's what we're hoping for.
That's correct. Certainly throughout the pandemic, we've seen our wait list increase a little bit because we've had staff pulled to support other pandemic efforts. So these new clinics will certainly help us catch up on that wait list volume. So we do have a bit of a wait list specifically for our seniors, but for some of our Healthy Smiles Ontario families as well. So we're hoping that once these renovations are done, we can knock off that wait list.
So dare I ask you, and this is just one ask, but I may have more, when do you think it'll be done where you can have your, ribbon cutting, opening, whatever?
So we are targeting, correct me if I'm wrong, Nicole, we bounced a few dates around, but I think we're going to open operations, if all goes well, March 21st. Get back in our Owen Sound Clinic. So we're about 1 month away, and I was just downstairs a little bit ago and speaking to the contractor, and they are making great progress. They're getting lead lining into the walls so we can do our x-rays, and they're starting to drywall up some of the piping and things that they've been working away at. So definitely seeing good progress, and over the next few weeks we'll have our equipment installers in to install our new chairs and lots of other pieces of equipment that we've been able to purchase with this grant. So we're getting excited.
Yeah, I think it's wonderful. So we've been hearing that there's been a challenge with supplies and, the chain and the skills, the skilled trades, but it sounds like things are moving ahead. You haven't been too negatively impacted by supply chain issues or skilled trade issues.
No, I would say generally not. I know we hope to have this contractor in earlier than January 7th. We had hoped to get them in the fall, but there were some challenges in them securing supplies in a timely manner. So we did have to push that back slightly, but still within the timelines of the grant.
So when it's open and operational, how many staff? I guess we would call them staff, right? They would be public health units staff. How many actually would be there, and how many days would it operate? Like the real logistics, what are you hoping for?
Nicole, do you want to take that one?
Yeah, for sure. So we'll definitely have every week 3 full days of dentists in there. We have 1 dentist who joins us 1 Friday a month, and then we'll be running 4 days of hygiene.
That's a significant amount of coverage. I think that's wonderful. No wonder you're excited, Jason, to see this come, because that will be great for sure. Would you say that in Grey Bruce or Owen Sound specifically, we know we have a little bit higher number of seniors compared to perhaps other areas. Did that impact your decision to go ahead with this type of grant request? What prompted the issue? Was it just waiting list?
I think it was just an acknowledgement that yes, we are going to be seeing quite a number of seniors. The income thresholds did just recently increase as well, so more seniors will be eligible. But also recognizing that our clinic hadn't been upgraded since it had been, I guess, installed into the building quite a few years ago, so we were due for some upgrades. So not only, as Nicole mentioned, will our operatories be upgraded with the addition of a new operatory, but there'll be some nice charting space for our staff. Our reprocessing room where we sterilize all our equipment has been upgraded with some new equipment. And we've also added a panoramic x-ray machine, which is different than a normal x-ray machine. It's almost, it'll be in, it's kind of like a walk-in closet, and this machine will actually take photos, kind of a 360 view of your mouth. So the dentists and our hygienists and our educators can get a full sense of what's going on in our client's mouth.
Which is an expansion of the service, which is excellent for sure, to have that panoramic x-ray opportunity for sure.
I hope I said that right, Nicole. I've learned so much dental lingo, Carol, managing this program. It's crazy. I knew very little coming in, and now I've got this whole new vocabulary.
That's great. So I read from the statistics, for sure when the schools were closed throughout the pandemic, I mean, it affected the school programs, but there was still screening and care being provided. But since the school year has started again, there's been a significant number of children who have been assessed already. I'm not sure, Nicole, if you wanted to speak to that, or, you know, I read the numbers and I was quite surprised. It said so far this school year, 3,456 students have been screened. So this is an active program.
Yes, very active. And in 2019, we compared numbers, and they screened, the hygienist had screened 6,400 students, I think. So 2020 was a year we didn't get into schools at the beginning of the year. So that was not, our numbers weren't there at all. If parents called us though with an emergency or a concern about their child, we did have the opportunity to do teledentistry. So our hygienist would call and they would speak with the parents and get consent, and then we would enroll the child that way. Because so there was definitely some ways of about that we could do. So.
Going forward, do you anticipate you will do that teledentistry or that screening that way in the future for anyone who lives far away, or weather conditions? Do you anticipate you'll do that?
I think as long as their college says that we can do that, then yeah, for some people, it just makes it simpler and easy access for them. And like you said, weather, or maybe they're not able to get a ride into one of our clinics. So it's definitely beneficial.
So the question I have is relating to what you're seeing now as a result of perhaps a bit of time since the screening has been able to be done within the oral health of children and seniors. Are you seeing things that might concern you or surprise you?
Yeah, I would say we just had a little chat with our team this morning with some of the team that's been out in the schools, and they did say that they are seeing significantly more decay in some instances than they would have seen historically. And I think that's a bit of a reflection that we didn't get into the schools last year due to the remote learning. So there's been that extra year where children are maybe sitting at home, maybe eating too much sugar. I'm not sure exactly all the causes, but we are seeing more severe oral health issues in some of the children we're screening. So we do expect that we'll be referring a greater percentage of those kids to the Healthy Smiles Ontario program.
Yeah. So certainly that's something that not having the care, it almost is proof of how important this program is to be able to stay on top of those issues, and for oral health. It almost proves it accidentally, but incidentally in relation to the pandemic. And for the seniors, would any changes relating to seniors, same patterning, or?
The seniors we've been seeing right through the pandemic. But again, this is a very new program to us. It's just, we're about 2 years in. So I think we're still learning and trying to get through the wait list, as we mentioned. So I think we'll start to see probably more trends as we move along.
I'm wondering if you can speak about the importance of this program in relation to obviously general health, population health, and the impact on individuals over their lifespan in relation to oral health.
Yeah, I will just say generally, and I'll let Nicole jump in. I know she's had a long career in private practice and in public health, but just we know oral health is a strong component of overall health, just like physical or mental health. And if you're dealing with troublesome teeth, that you're not going to be very well physically or mentally. So we certainly want to, people who need our service, we're certainly here to help.
Yeah, and people who have possibly been without teeth for years and years and, couldn't afford a set of dentures and that sort of thing. It's something we can refer to, and it's very minimal out of pocket that they would have to pay. That is our only thing that we require a co-payment for, but it's very minimal of what they would have to pay for a set of dentures.
So there's some big advantages for those individuals. As we're going through the experiences, we are finding more and more eating healthy and proper nutrition is becoming more and more challenging with the costing of food items. Can you talk a little bit about the connection between proper nutrition and oral health?
Yeah, definitely our hygienists, when they come in for their hygiene appointments, any client, we do what's called oral health or oral hygiene instruction. So they definitely go over proper eating. That's one thing we always like to chat about with the parents is we know how kids love snacking and love sipping all day on sugary drinks and just going over stuff like that. And what kind of snacks they should have before bedtime, because some of those carbohydrates they're eating aren't going to go away before they go to sleep, and proper brushing. A lot of people don't brush their teeth 2 times a day. So going over that type of hygiene with them and diet. And a lot of our seniors too, it's based on medications they're on as well. It causes dry mouth in some clients. So making sure that they're getting their water intake to help the salivary flow in their mouth and to wash away the sugars and acids and everything they eat.
And it's helpful because when people are finding the side effects of the medication, to know what they can do, that there are choices and options as well, for sure. So moving forward, after March, when the renovation is done, what would be the volume you would hope to put through, whether it's a daily volume, and how will that impact the waiting list? In other words, at peak operations, are you anticipating still having a waiting list?
Yeah, we're probably going to be a little while to catch up on our waiting list. As Nicole mentioned, our clinic here in Owen Sound is functioning every day of the week, either with a hygienist or a dentist. And we typically see, Nicole, would you say 3 or 4 clients a day, usually about an hour and a half appointment if they're a new patient exam and we need to do the assessments and treatment. So I can't do the math in my head, but we're probably seeing 20 to 25 clients a week in Owen Sound. And then our other clinics operate 1 or 2 days a week. So Markdale is 1 or 2, same with Wyerton and Walkerton. So we're again seeing 3 to 4 clients or families during those clinics when they're open as well. And we'll probably look to increase the number of clinics we're offering a week, just to do a little bit of catch up. So we may be looking to offer 2 clinics each week in some of those locations remotely outside of Owen Sound.
So with the staff that are at Owen Sound, do they rotate to the other sites as well, or how does that work?
We typically have teams dedicated to each area. So there's a hygienist and an assistant that are primarily dedicated to both Markdale, Walkerton, and Wyerton. And then we have a little bit larger team that are focused on services in Owen Sound because we do operate here a little bit more often. Anytime we do run a dentist clinic, we do need to have 2 assistants supporting that dentist because the work is a bit more complex and there's a little bit more to address. So that is a staff resource as well. And yeah, I think that's basically the volume that we're looking at, and taking into consideration we're not only doing these clinics, right, Carol? We're out in the schools most days of the week, so that pulls part of our team away as well. And then we do have a team of hygienists and educator also running our co-high program as well with our First Nations partners as well. So there's draws in a few different directions, but we're trying to run as many clinics as we possibly can to catch up.
Using the maximum human resources in the best way you know how, for sure. So in the last few minutes of the program, is there anything you'd like to add? Because I do have a question.
You start with the question and then we'll add from there.
All right. I know in previous programs when we've talked about oral health, we've talked about sensitivity of those who are perhaps at lower income, going to dentists or being hesitant because of the low income. And I know that's handled very well at the dental offices as well. Can you just discuss that briefly, so anyone who might just be a little hesitant to take advantage of the service because they don't want individuals knowing that they're on the program, how can you reassure them?
Nicole, can you just speak maybe to the enrollment process? I know that's very straightforward and confidential. That might put some people at ease.
Yeah, so how to enroll. So there's different ways you can enroll. You can call our line out 519-376-9420 extension 8, and we can mail you a form. You can pop into the public health unit and grab a form at the front desk, or you can go online and you can submit online or print off a form and mail it in also. We have nothing at public health to do with the enrollment of it. It's all done through the Ministry of Health. Okay. So they're the ones that will enroll you. And then once you receive your card in the mail, then you call us. Every client we see, whether it's in private practice or at Grey Bruce Health Unit, everything is private and confidential. We don't discuss any matters with anyone except the dentist that we're working with. So as for privacy and confidentiality, there's no concerns or worries there.
And I'll just add, hundreds of people are coming into our building every day for different services. We offer a variety of services, so there's really no way to know whether you're coming in for a dental treatment or to check your well water or any of the other services that we would offer.
Yeah, and that's important to know. I think that all of those factors are in play, and the service is available for those who need it. And it's helpful to know how to get that referral or how to initiate the process, for sure. Well, I think it's exciting news for sure about the expansion and obviously meeting a need in our community. So I hope you'll send us a picture of the new digs once they're completed. And please come back and share the news and celebration with us when you're expanded. Thank you both for being here today and telling us more about this exciting program, and take care. Thank you to our viewing audience. And please join us again to learn more about programs, services, and resources available to you and to your family. Take care and stay safe. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Hi, I'm Cedric Gano, and I'm a center for the Owen Sound Attack. Catch great OHL action on Rogers TV as we bring you Owen Sound Attack games live, both home and away.
Everybody knows not to drink and drive, but some people still think it's okay to take drugs and drive. Police have the authority, the ability, and the tools to determine if drivers are impaired by legal or illegal drugs. And because drug-impaired drivers can pose just as great a risk as drunk drivers, they face the same